Early on in the pandemic, we were very limited on testing. There was a nationwide shortage of swabs and testing supplies. There would be days that we would have only 3 swabs left. The labs were too slow and we weren't getting test results back for 10 to 12 days, and that's not helpful for limiting the spread of disease.
Conversations about starting the lab probably date back to the beginning of March, when we realized there was a crisis here that needed to be addressed. We were reading the national news, the international news about the lack of testing. We all cared very much about our community. And there's some brilliant scientists on campus who we knew were able to create the test. What is truly extraordinary is that we started talking to partners in the community that provided health care for vulnerable populations.
When the schools closed in March, people immediately began losing their jobs. The shelter-in-place order sent many people to receive food at the Second Harvest food distribution. I remember looking at the lines down Beach Street of cars lined up to get groceries and thinking we must do everything we can to increase testing, contact tracing, and to provide a wage replacement for those who were not able to work due to COVID.
It was critical to us that the test we produced was highly accurate, that we delivered on time. Part of our strongest desire was that we return test results in 24 to 48 hours. And that's what we've managed to do.
It's been really amazing how all of the partnerships in Santa Cruz County has made our response to COVID in the county much better. But the partnerships between public health, UC Santa Cruz, the community health centers, as well as all of the medical providers in the county, all of these types of things have really made our response possible in the county. And it's hard to imagine how a community could deal with COVID without having all those partnerships.
We had this group that was very supportive of providing testing to vulnerable populations or populations that really couldn't access the test easily. And we had a network for the safety net clinics. And then the Community Foundation played a role not only in supporting our testing, but also in bringing all these groups together and assessing where the needs are.
So I study infectious diseases, and specifically for COVID-19, I've been working on trying to understand both how the virus is spread and also what we can do to stop it. So the virus spreads primarily through kind of sustained close contact between people without masks, and especially in indoor spaces. The virus spreads most easily within households, but also can spread within a car, two people traveling together in a car. Obviously, if we have a social gathering inside someone's house, it can also even be spread outdoors if people are close together without masks.
COVID has really disproportionately affected Watsonville and Latinx residents of Santa Cruz County. And there's a lot of different reasons for that. Primary one being that a lot of the Latinx community, as well as the community in Watsonville, are essential workers in Santa Cruz County. They don't have jobs where they can work from home, so they're exposed to the public more. Unfortunately, a lot of these essential jobs are low-paying jobs, and we live in a county that's a really high cost of living. So that ends up resulting in crowded housing situations. You have a perfect setup for more spread.
There's a lot of reasons why this part of the community has been impacted more than others. One is the lack of communication in their native language that's come into them, right? The lack of access to a lot of the information. A lot of the information out there is digital, and we're working with a community that really struggles to, one, have the economic resources to get the tools to tap into that digital world. They're essential workers. They need to go out there and they need to work in the fields. They need to go out in the restaurants. They need to go out and work in hotels. They don't have that luxury of tapping into economic reserves. Their work requires them to be out into the community, so which is just going to increase their possibility of being exposed to COVID.
I joined the Recovery Council to try to help provide the latest science for the local businesses, really to do what we can to keep people safe. And I think one of the challenges for the businesses and the public in general has been that there's just this barrage of information being reported by the press every day. The real focus that I've tried to provide to the ERC and the businesses is really just these core principles: giving people space, requiring people to have masks, and then trying to set up systems that enable people to be able to make themselves safe and the people around them safe.
We've been doing a lot of work to get more education out to the community about how to best protect yourself, how to get access to services if you do need testing. And we've done that through the Pajaro Valley Save Lives communication group.
How do we spread information out to the community around how to come together safely, or not to come together at all? So that's really what a lot of the communication effort was. We're hitting the Spanish-speaking community, Mixteco. We're talking about radio. We're talking about TV. We're talking about social media.
The NEST course started because of COVID. The public health team works with volunteers and the Save the Lives Matter group in creating graphics that offer alternatives on how to celebrate. They also came with pamphlets that said, like, in Spanish and English on, like, okay, where can you go virtually to celebrate or to see different things that were going on in the community, such as the Watsonville Film Festival.
The things that worry me the most are that the current situation is really, really tough. We have a huge amount of the virus spreading in our community right now, and people are getting sick at a very high rate. Our hospitals are kind of maxed out. Our desire to be social as a kind of a species sometimes outweighs our knowledge and our kind of decision-making to be safe. And especially for some people that don't have maybe economic means, we don't have ways to have those social interactions in a safe way. So the combination of, I think, a lack of resources for some people, plus this kind of real desire to gather and to kind of meet with friends and family, especially we don't live with, creates, unfortunately, dangerous and risky environments for spreading the virus.
The funding from the foundation has been critical. Pretty early on, there was not submit a proposal or come back to us in a month. We're going to, write up, the process for this. It was yes, and we can help. The work that you're doing at the Digital Nest, the work that the youth are doing is critical to our safety and our health of our community.
The most important thing is how people have come together during this crisis and how there is the expertise that people bring, for sure, but there is also this strong desire to work together here in Santa Cruz. And I am deeply impressed by the way the leadership of all of these organizations has supported working towards what really is pretty extraordinary, fast movement to come to solutions. And it's never been perfect, and there have been lots of bumps along the way, and everybody has managed to work through those very quickly to the common good.
The hopeful part to me is that most of us, not all of us, but most of us have the power to keep ourselves and our family and friends safe by basically choosing certain kinds of safer behaviors. And then these 2 vaccines finally know that they're actually quite effective and they're finally being rolled out and given to people. Those will really provide a light at the end of the tunnel from this pandemic.